Janna Maramo, and today we are going to have a very interesting conversation about patient safety and ethics.
That's right, partner. Welcome to all our viewers. I am Diane Megallon. Naalala ko nga ito yung topic nating last week sa surgery eh.
Actually, oo nga, no? Tapos medyo naalala ko pa din yung pag-emphasize ni Doc, ni Schwartz. Grabe si Schwartz. Para ma-emphasize yung mga concepts and everything na theoretical na pwede natin magamit in the near future. Ikaw, partner, what are you looking forward today?
Siyempre, mas magkaroon ng bagong perspective and learnings kasi balita ko, may makakasama tayo today that has valuable experiences of her own regarding the topic since she has been a key player in the field.
Kaya wag na natin patagalin pa. And without further ado, let us welcome our guest, Dr. Obra-Roces. Hello po, Doc. Good afternoon po.
Hi guys, good afternoon everybody. Great to be here.
Hello po, good afternoon po, Doc. May we ask lang po if ano po yung preferred yung itawag po namin sa inyo?
Yeah, so you guys can call me Chikki, Chikki. Do not call me Lois. I only get called that if I'm in trouble. So Doc Chikki is the way to go.
Okay po, Doc. Thank you po, Doc Chikki. We are very excited po to have you here today. Maraming salamat po sa pagpapaunlak ng aming imbitasyon. So before po tayo mag-start, we would like to know you a little bit better. So as part of a little getting to know, pwede po ba kayong magbigay ng any 3 random things lang about yourself po?
Oh my gosh, this is really quite random. All right, so I think the first random thing is my Tagalog is absolutely horrible. I'm not from Batangas. I'm originally from Cebu. So if I seem or sound weird speaking Tagalog in the future, my disclaimer na kayo. So that's the first random thing. Second random thing is I got budod by a Batangueño. So originally from Cebu, but now here in Batangas because my husband, who is also an ortho surgeon, is from Batangas, hence the relocation. And random fact number 3, we both don't have kids yet, but we are the happy friends of 5 very cute cats that's eating away our savings. There you go, random na random.
It's so nice to know po na pet lover po pala kayo, Doc. So, mukhang medyo naka-warm up na po tayo. I'm pretty sure na our audience are excited to meet you po, Doc. With that, okay po. Can you tell us more about yourself po, your specialty or subspecialty, training institution, and area of practice?
Right, so I did my medicine education in Cebu. So that's in Cebu Institute of Medicine. And then I went to St. Luke's Institute of Orthopedics and Sports Medicine in Quezon City for my residency in orthopedics and sports medicine. After that, after I passed all the exams, I did my fellowship training in pediatric orthopedics. First one was in Fukuoka Children's Hospital in Japan, followed by a longer fellowship at the Duchess of Kent Children's Hospital in Hong Kong. So currently, I am practicing Batangas City, although I do also practice in the Alabang area, Makati area, and I'm a visiting consultant in Tacloban and Bicol. So all around, in
Sabado
short.
pa, nung nag-McDo kami ni Cham.
Sabi, Doc, all around po talaga kayo.
Diba?
International at national levels. Opo. So, medyo to start this off po, since you've been practicing nga po as a surgeon, what steps po do you take to ensure a safe operation?
Right, so that's very, very important. A very major part of the safe operation that we do is we always make sure that we're operating on the right site and on the right person. Okay, so time out, if you guys have heard of it, is a very integral part of our operations. We do it all the time. And this is to make sure that everybody kind of stops what they're doing and we all focus on the subject matter at hand, which is the surgery. So we all make sure that we're doing the right procedure on the right patient at the right time, because sometimes they're staged procedures. So we want to make sure we're doing the right one.
That's nice to know po, Doc. Pero prior to that po, may we know what is your protocol when obtaining informed consent po? And
Sorry, go ahead. Yeah, go ahead.
go ahead po, Doc.
Hindi, wag na. Ikaw na yung nauna. Go on, go on.
Meron na po ba kayong situation na na-encounter na yung informed consent po was not properly obtained po, kahit tulad po sa emergency cases or yung mga unconscious na patient po?
Yes, I have several, but siguro off the top of my head, maybe I'll go first into your first question on how I obtain the informed consent. I would say I'm quite ok when it comes to the informed consent, partly because I come from a strict training institution. So I come from St. Luke's, and alam mo na, the rules are very rigid there, and it's really very well regulated. So it's part of my training. And secondly, I'm just OC by nature, so I that's the majority as well. So when I do my informed consent, I really do sit down with the patient and go through the entire form. So I don't know how it is for some surgeons. For the most part, I do know they just gloss over it, but I really do read through it with my patient and then go into each statement with numbers. Do read through the entire informed consent with my patient, and then with each statement in that legal document, I do go into the actual numbers based on actual evidence with the patient. Okay. Then as for a situation wherein the informed consent was not properly taken, so this was in my residency days, and it was not me. Okay, it was not me. Let's not disclose names, but there was somebody who took the informed consent. But this particular patient was 14 years old. Okay, so this patient was 14, but mature for her age. So if you're talking to her, she completely understands what's going on. She knows what's happening. So she signs off on the consent because said person who took the consent did not check that she was 14. So now come operation time, and of course, St. Luke's, we are checking all the documents, and we find out that the signature on the consent is of the patient who is 14, which is not, it's not accepted, it's not legal. So luckily we caught it in time, and we did have to go back and talk to the parents because it is the parents or the guardian's signature that needs to be on that informed consent. So there you go. A benign example for you. I don't wanna air the dirty laundry of of what I've been through, but that's I think a good and basic example of how an informed consent was taken wrongly.
Doc, ano po, in terms po of like unconscious patients, like how would you approach that naman po, Doc? Pag,
Okay.
or what? Sige po.
Yeah, so normally for unconscious patients, they should have an emergency contact person, right? So that's the first thing that you check. And secondly is most of the times these patients come in with somebody, right? Somebody with them. So you should exhaust all efforts to contact first whoever needs to be contacted. End result is if you really cannot contact anybody, then it comes down to you as the decision maker to do what needs to be done to stabilize the patient. But you should be able to document that you tried to contact who needs to be contacted for this particular patient.
Thank you, Doc, for your insights. Surely po na baka maka-encounter kami ng mga ganong situations. And now, we
Oh
would
no,
give you...
wag naman kayo. Let's knock on wood.
I mean, equipped po kasi na-share niyo po yung experience niyo. Okay po. So, ngayon po, mag-proceed naman po tayo sa patient safety. So, nabanggit niyo po kanina yung dapat nga po na hindi po magkakaroon ng, I mean, meron pong term kasi si surgery, yung surgical never events po, yung na-describe niyo din po kanina. Ano po kaya yung mga factors that could probably contribute po dun sa tinatawag nating mga surgical never events po?
Right. So this is actually a term I'm not very familiar with. No. So first time ko siyang nahirin. So if you don't mind, what's the official definition of a surgical never never event?
Doc, ano po, according po to sa isang, sa NCBI po, Doc, never events po daw ay errors in medical care that are clearly identifiable, preventable, and serious in their consequences for patients and that indicate a real problem in the safety and credibility of a healthcare facility po, Doc.
Right. So again, I think I jumped ahead of myself siguro, no? So earlier in this talk, I was telling that the surgical timeout is really very important with this in particular, because it does help prevent these mga surgical never events.
Okay lang po, can you elaborate further po dun sa surgical timeout? Like, kahit din po sa hospital niyo po, ano pong protocols niyo with the term, with surgical timeout po?
Maybe yun. So we do the timeouts very regularly. So it's part and parcel. We do not start without doing the timeout. And then maybe another example would be if ever we do need to transfuse blood intraoperatively, everything actually also we pay attention to what's going on. So we make sure that the right blood type is given to the right patient, and you actually have more than one person who is signing off on the type of blood that's being given. So if you haven't seen how it's done yet, there is actually a sticker in the blood na ibibigay sa'yo. And then sabay kayo, no? So both of you will read out that sticker and will read out the name of the patient and the patient ID number before giving anything to the patient.
So, Doc, when performing, di ba po, ng surgical procedure, sa beginning and sa end po, meron pong tinatawag na surgical count. Dito po binibilang yung mga instruments na gagamitin or ginamit para po ma-ensure na complete po yung materials and instruments at hindi po na-retain sa loob ng katawan ni patient. So, in relation to this po, Doc, do you have extra measures to ensure po na yung surgical count is correct po?
Okay, so I like surgical count, no? I think it's very important. So, here's the thing. Surgical count is, if you look at the hospital, ano ba, like delegation of roles. See, surgical count is nurse, di ba? It's not like the surgeon suddenly stops whatever you're doing and then counts. So, it really, really is the nurse ang ano dyan, ang medyo head dyan. But you can help out and make sure that it is accurate by paying attention to what's going on. So if si nurse, pansin mo, nurse is counting, you stop and then you say, how are we? Do we lack anything? Is anything missing? Are we okay? No? And also, if you are, sometimes when you're in the heat of the moment sa surgery, no, you're just grabbing things off of the nurse's table, hindi mo na pinapaalam sa kanya, ano naman, be cautious enough to inform. Like if you are sticking a clamp somewhere deep inside the field and you know that the nurse cannot visualize it, tell her, ma'am, may pinasok ako sa loob. May clamp dyan. May OS dyan, dalawa. Tell them so that everybody in the room knows what's going on. And then lastly, because the final count is usually si scrub and si circulating. They count together everything. So aside from just, alam mo yun, the common practice is just counting with the eyes. So you kind of, yan, isa, dalawa, ganyan. Meron dyan, may tatlo dyan, ganyan. So it really is a good practice, and I picked this up from my time in Japan. A good practice is to point to the thing that you're counting. 1, sabay kayo, you see the same thing. 1, 2, 3, tatlong OS. Do not say, 1 pack, tapos na. And then you're not counting each individual gauze that's there. So the action of saying out loud the number and pointing to the specific thing just increases the overall accuracy.
Nice to know, Doc. Thank you po for your sharing. Tapos, Doc, in practice po, di ba, meron din po tayong tinatawag ng mga certain events and mishaps kung saan nako-compromise po yung quality of care. So sa training nyo po, naka-encounter po kayo ng mga tinatawag po nating sentinel events or yung mga serious clinical incidents po na nag-cause ng serious harm or death?
Well, yes, no. So unfortunately, it is part and parcel of being a surgeon. You do encounter sentinel events. Siguro for the sake of this, ano ba to, like podcast, this podcast, can you define what a sentinel event is? What's the official definition?
Sige po, Doc. So yung sentinel event po refers to a subset of serious clinical incidents that have caused or could have caused serious harm or death of a patient po.
Yan. Oo, madami yan. Okay, so I think the most common for all surgeons, I would suppose, is a lot of blood loss, right? Hindi mo mahabol yung bleeding. So that, I think, qualifies as a super sentinel event. So, well, you can control it by being meticulous with your procedure and by being prepared, no? Make sure your blood parameters are okay. Make sure you have blood prepared. Make sure your anesthesiologist knows what's going on para they can help you control the bleeding by giving medications.
Nasabi niyo na din po yung mga possible steps para hindi po siya mangyari. Pero paano naman po siya talaga, Doc, like sobrang maiiwasan po? Or hindi po talaga?
Well, you do what you can, right? I mean, you get to know your patient as much as you can. Like I said, blood parameters, that kind of thing. And then, I guess the best way to prevent it is to anticipate it, no? So I mean, you kind of know if your surgery is gonna be really bloody. So if you know it's going to be really bloody, just be more meticulous in your hemostasis, be more meticulous in your dissection, have the blood ready, tell your anesthesiologist, and kind of anticipate that that kind of thing is going to happen, because minsan hindi mo talaga maiwasan, especially for tumors, you know, really friable tissues. It's something that you can't get around.
What if po, Doc, may instances na yung patient po is not satisfied with the procedure and nag-decide po siya to consult another surgeon? What do you expect po from the other surgeon and the patient po?
Aha, sige. Well, ganito. Ethics naman, di ba? Ethics dictates. We never bring our fellow doctors down. Okay, so that's really important. Never, 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 never. Even if in your heart of hearts, in your deepest thoughts, you kind of disagree with what this other doctor is doing, you never ever bring down that doctor, lalo na sa harap ng pasyente. No? So what I would expect, I would think if a patient of mine is not satisfied and would go to somebody else for another opinion, I would expect that other doctor to kind of respect my decision making. Sa totoo lang, they don't really know what happened, di ba? Inside my surgery, they don't know how, anong iniisip ko at the time that I'm treating my patient. So at the very least, do not, do not, what's a good term for it? Like, do not bring down, do not bring down your colleague just because you do not agree with the management. Then secondly is, I would also expect that doctor naman to, this is not a hard and fast rule, ha? Not a hard and fast rule, but sometimes, lalo na in complicated cases, it's nice to know, no? So if that other doctor will get back to me and say, na, oy, nakita ko pala this patient because blah blah blah, like this is the reason why they were not satisfied. I think that helps me improve my own practice. That helps me understand what went wrong sa case na yun. And then in the end, everybody comes out all the more better for what happened.
That's nice, Doc. Doc, paano naman po pagbaliktad? Like, if ever po na yung patient po nung another surgeon yung pumunta sa inyo, tingin niyo po, ethical po siyang tanggapin?
Oh, yes. Yes. Okay. So patients will really, alam mo yun, lalo na if you indicate a major procedure, they're going to shop. They're going to look for a doctor who will tell them what they want to hear. No? So they'll go to like 5 doctors. Itutunong pa nila yan ng 11-11. Mga doctor shopping talaga. They'll go to as many doctors to hear as many opinions as possible. So when that happens to me, no, and I do get some patients like that, I just say bluntly, I agree. I agree with what your first doctor said. If it were me, this is what I would do as well. It's not unethical. And then if the patient decides naman na pupunta sa iyo, then you know, it's also nice, it's a good courtesy to inform naman yung other doctor, yeah, para lang malinaw yung mga pangyayari.
Okay po, Doc. Thank you so much po, Doc Nikki, for this insightful conversation. Actually, madami po kaming naging takeaway sa conversation na to kahit limited lang po yung time. I'm pretty sure na yung audience po natin shares the same sentiments po. Pero bago po tayo tuluyang matapos, pwede po ba namin kayong mahinga ng kahit onting message lang po para sa mga aspiring doctors? Especially po dun sa mga may interest po maging surgeon po.
I will say that you treat all patients, each patient that comes to you, you treat to them as if they're your family. You know, do not do things to them that you would not do on your own family member that you love and care for. So I think if you have that mindset, tama lahat yung gagawin mo, and even if you cannot do the best, no, like hindi talaga kaya, you know that you did what you could. So in the end, you're able to sleep better knowing you did what's best for the patient. And your patient, you're also sure that your patient gets the best kind of care. Like, you know, do not dismiss this person because reason. Treat everybody that comes as if this is your own family member.
That was really inspiring, Doc. And we
Really? Ilagay sa karatula. Ilagay sa tarpaulin.
Pwede po, Doc. Pwede po. Doc, ano po, another thing din po, like, kasi po mga medical students din po yung nakikinig sa atin. dito sa podcast natin, meron din po ba kayong a little bit of cheerful
Cheerful.
motivation for everyone na medyo nandun lang din po sa roadblocks in this
In your
moment?
medical school.
Your
Oh,
medical
believe me, I had several. I had several roadblocks, detours, mga road closed, mga ganyan. Med school, it's a journey. It doesn't end by the time you graduate. Actually, ako ngayon, I'm still training. I'm still learning. I'm planning to do another kind of fellowship next year naman. Siguro, but the best advice, and this is what got me through med school as well, is that you take one day at a time. One day at a time. Do not stress about, exam next week. Oh my God, exam, basa, blah, 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 blah. One day at a time, and that's how you survive.
Oh, thank you po, Doc. Again, on behalf of everyone on the group, Miss Malabanan, myself, Miss Maramo, Miss Marfa, Miss Megallon, Miss Mendoza, and Miss Natividad, we thank you for your time and your stories, Dr. Chikki Roses, and thank you po.
Sure, you guys.
Bye,
Thank you so
everyone.
much po, Doc.
Bye-bye.